Have you ever just stopped and looked at your smartphone and thought, wow, this thing probably knows more about my health than my own doctor does? Well, let's dive into this explainer, because today we're tracking an absolutely incredible leap. We're going from the primitive, clunky emails of the 1990s all the way to today's AI-driven digital phenotyping systems. We're going to explore exactly how artificial intelligence has completely revolutionized the way we track, understand, and even predict our collective well-being.
Here's what we're looking at today. First, the 1995 email experiment. Next, the digital data evolution, followed by enter the AI era. Then, tracking your health ecosystem, and finally, the future of public health.
Section 1. The 1995 Email Experiment. So we have to rewind the clock a bit here, long before apps or smartwatches were even a glimmer in a developer's eye. The year is 1995. Emeritus Professor Wagner Marcenes publishes this truly seminal paper on dental public health. And while all of his peers were completely bogged down using paper forms and physical mail, Marcenes put together a brilliant proof of concept. He showed that, yes, electronic formats could actually transmit and aggregate population health data. This right here was the key that unlocks the door to modern cyber-epidemiology. And at a time when the internet was, frankly, incredibly primitive, we're talking screeching dial-up tones here, Marcenes made this beautifully prophetic observation. He stated that the internet had the potential to democratize knowledge. He didn't just see a quirky new way to send a message to a colleague, he foresaw a mechanism that would fundamentally change how we gather vital health data on a massive global scale. Just think about the sheer friction of the old days for a second. Epidemiology used to mean stuffing envelopes for traditional paper mail, conducting hours of telephone interviews, and filling out endless, expensive in-person clinical forms. It was slow, it was costly, and honestly, it was really limited in scale. But today, we're talking smartphone sensors, app-based ecological momentary assessments, and real-time AI processing. The friction has literally vanished. We're now capturing richer, much more accurate data without even interrupting your day. Which brings us to Section 2, the digital data evolution. Now, obviously, we didn't just teleport straight from primitive emails to advanced AI. It was a step-by-step journey over 30 years. In the early to mid-90s, we relied heavily on text-based email and command-line interfaces. By the late 90s, things got a bit smoother with simple HTML web forms using CGI or PHP. But a massive, massive turning point hit in 2006. That's when Google Forms democratized dynamic digital surveys, making them essentially free and accessible to anyone. And that set the perfect stage for our present day, which is defined by continuous, passive digital phenotyping and AI. Honestly, can you even imagine the sheer amount of effort it took researchers back in that early experimental era? Operating over primitive academic networks like BitNet or early TCP/IP, you practically had to be a computer scientist just to format a plain text questionnaire. And then, every single text response had to be manually parsed. It was a painstaking, grueling process. But it sparked the exact automation that we completely take for granted today. All right, let's move into Section 3, enter the AI era. Okay, so this is where those clunky, static forms are left in the dust. Instead of you sitting down and actively answering questions, your phone is now passively assessing your health in real time. This is what experts call digital phenotyping and EMA, or ecological momentary assessments. By leveraging the sensors already built into your smartphone, modern epidemiology uses continuous, real-time AI processing to gather your health data remotely. It's looking at things like mobility patterns, sleep, and activity, all right there in your natural environment. If we look at how this transition breaks down, it is wild how much the burden has shifted away from human effort. We've moved from active collection methods, where you actually had to fill out HTML forms using server-side scripts, to completely passive smartphone sensors and remote apps doing the heavy lifting in the background. Manual or basic aggregation, that's been replaced by real-time AI processing. What once required a specialized web developer to set up is now a fully automated routine part of our modern health infrastructure. Let's dive into Section 4, tracking your health ecosystem. Now, you might be thinking, what's the point of all this? Data just for the sake of data is pretty useless, right? But when AI organizes its information, it reveals the invisible structures dictating our well-being. This is known as the health capital model. It looks way beyond narrow, isolated medical interventions, like just popping a pill for a cold. Instead, it focuses on understanding the broader structural ecosystem of health, specifically addressing the environmental determinants of health, which, as we know, vary drastically from one neighborhood to the next. And here is exactly how AI makes that happen in 3 distinct steps. Step 1, it allows us to collect massive global data via studies like the global burden of diseases. Step 2, we gather localized public health data from those broader pools. And finally, Step 3, we assess specific community-level health conditions, pinpointing risks and finding feasible solutions. It's literally taking the data from the entire globe and filtering it straight down to what's happening on your street.
Finally, Section 5, the future of public health.
So the absolutely crucial takeaway here is that this evolution, it isn't slowing down anytime soon. AI-driven tracking is not just some fun tech experiment anymore. It is routinely and fundamentally the backbone of modern health assessment. The digital connectivity that started with a simple email experiment in 1995 has underpinned modern epidemiology, and moving forward, it will entirely underpin our future health systems through electronic communication channels. As we wrap up this explainer, I want to leave you with one final thought to mull over. You are an active part of this massive data ecosystem. Every single day, your digital footprint contributes to our understanding of global health, fulfilling that 1995 prophecy about democratizing knowledge. But given that AI and your smartphone are now continuously and passively tracking the environmental determinants of public health, how comfortable are you with your digital footprint actively shaping the future of global epidemiology? Thanks so much for joining me on this explainer. I'll catch you next time.